Hello everyone. Today we have an article on the importance of walking as a good exercise for everybody, and it's very good to help in our heart health, the health of our heart. It's very good against other diseases also. It helps us fight against depression. You get out and you do some walking and you feel a lot better. Let's take a look at the article right now. The Jewish Voice, July 7, 2017. More Americans are walking for exercise. It's an easy, inexpensive way to get moving and reap the health benefits, experts say, by Steven Reinberg. Call it a step in the right direction. More and more Americans are trying to walk their way to better health. The number of adults who took up walking for exercise or as a way to get from place to place increased significantly between 2005 and 2015, federal health officials reported Thursday. During that time, the percentage of women who walk increased from 57% to 65%. Among men, the percentage increased from 54% to 63%, according to the U.S. Centers for Disease Control and Prevention. Quote, people who are physically active have a lower risk of many chronic diseases like heart disease, stroke, and depression. And it supports the healthy aging process for older adults, said study lead author Emily Ussery, a CDC epidemiologist. On the downside, although most people are walking, the increase among men has stalled a bit in recent years, Ussery said. About 1/3 of adults who said, quote, they didn't walk for at least 10 minutes a day, she said. And about 1/3 of adults said, quote, they didn't walk for at least 10 minutes a day, she said. Quote, there is some work to be done to increase walking. One has to walk at least 10 minutes a day, more if not more. Let's continue on now. It's not clear why more people are walking, although it could be that messages promoting the benefits of exercising are getting through, Ussery said. Quote, it's an easy activity to do. It doesn't require a lot of special skills or equipment, she said. It's also not known why more women than men have started walking. Maybe walking appeals more to women than men, Ussery said. Regardless, people should engage in moderate exercise for at least 2.5 hours a week. And walking fits right in, she said. So it's important to exercise at least 2.5 hours a week. Communities can help get people walking by making streets safer and promoting walking programs. Quote, people need access to convenient and safe places to walk, she said. As with other matters of health, there are racial, ethnic, and socioeconomic disparities that exist between the people most likely to start walking and those who don't. Blacks and Hispanics walk less than whites, and less educated and poorer people tend to walk less than more educated and richer folks, she said. The report was published June 30th in the CDC's Morbidity and Mortality Weekly Report. Dr. David Katz is president of the American College of Lifestyle Medicine. He said the CDC finding that, quote, walking rates have trended up over recent years suggests the message is getting out, but progress is slow, and disparities are large and persistent. The people most in need of walking for health reasons are, one moment, here we are. The people that are most in need of walking are least likely to do it because of the usual factors: education, economics, and environment, he said. The people most in need of walking for health reasons are least likely to do it because of the usual social factors: education, economics, and environment, he said. Quote, affluent city dwellers can rely on walking to get them many of the places they need to go. Not so for residents of many rural and suburban neighborhoods, said Katz, who also directs the Yale Griffin Prevention Research Center in Derby, Connecticut. Quote, there are some encouraging signs here, he added, quote, but much work is clearly needed to create the level playing field of opportunity for health. Samantha Heller, a senior clinical nutritionist and exercise physiologist at NYU Langone Medical Center in New York City, said walking is a good way to start an exercise program. It only takes a pair of shoes and the desire. Quote, walking is free. We already know how to do it, and it can be done virtually anywhere. So we have the importance of walking as a good exercise that can be done by everybody. We have another article here. This is persistent stress may hasten death in heart patients. God forbid. Doctors should assess mental health at routine cardiac visits, study authors say. Steven Reinberg, this is another article that he wrote. If you have heart disease, unrelenting stress might hasten your death, researchers reported. So one has to try to stay away from stress, to try to reduce stress. The cumulative burden of psychological stress increases the mortality risk in patients with heart disease, said lead researcher Dr. Ralph Stewart. The association only applied to people with persistent stress, not mild or occasional distress, the researchers said, and the records hold true even after taking account of other potentially influential risk factors, said Stewart, an adjunct professor of medicine at the University of Auckland. Stewart cautioned that this study cannot prove that persistent stress causes premature death, only that the two are associated. Quote, however, there is other strong evidence that stress is causal. However, there is other strong evidence that stress is causal, he said. For example, the abrupt increase in heart attacks which occurred during war or after a major earthquake. The study didn't evaluate the reasons for an individual's stress. Quote, it is very likely there are many causative factors, including divorce, death of someone close, financial or job stress, Stewart said. Whatever the cause, steps to de-stress might improve your odds for longevity if you have heart disease, he said. Steps which reduce psychological distress over the longer term have the potential to improve outcomes for persons at risk. Steps which reduce psychological distress over the longer term have the potential to improve outcomes for persons at risk, said Stewart. Unfortunately, there is no simple solution to stress, he noted. Quote, the answer may depend on the individual and the reasons, he said. Let's see the conclusion. Persistent stress may, continued from page 43, acknowledging the problem is an important first step, and support from family and friends is key too, he added. Counseling is another option. Quote, sometimes people seeking professional help is best. Sometimes it's needed to see a professional. Sometimes seeking professional help is best, Stewart noted. The report was published online June 26th in the journal Heart. One cardiologist said doctors should routinely ask heart patients about the stress in their lives. Quote, clinicians should make the screening of psychological distress a constituent part of the routine assessment of patients with cardiovascular disease, said Dr. Jin Nuripepa from the Department of Adult Cardiology at the Technical University of Munich. At the Technical University of Munich. Any patients experiencing significant stress should then receive referrals to mental health professionals. This is especially true for a heart patient who has prolonged moderate to high level psychological distress, Nuripepa said. Psychological distress may cause or worsen heart disease by leading to increased activity of stress hormones and unhealthy behavior, said Nuripepa, who wrote an accompanying journal editorial. For example, someone with unrelenting stress might smoke, drink, become physically inactive, overweight, or develop diabetes, he said. Quote, in addition, cardiovascular disease itself may cause psychological distress, Nuripepa added. For the study, Stewart and his colleagues looked at data on 950 people with stable heart disease who took part in a long-term trial on cholesterol-lowering statin use. The participants were between 31 and 74 years old. All had a heart attack or hospitalization for unstable chest pain in the previous 3 to 36 months. The patients completed a general health questionnaire to gauge their levels of mental distress 6 months after hospital admission, and again 1, 2, and 4 years afterwards. So that is talking about how the study was taken. But the main part here is that one has to try to lessen stress as much as possible, and one should try to do the best one can. It's good to have people helping you, a friend or a professional that can help you out in trying to lessen our stress. So it's very important to try to make as little as possible with stress in our lives. It's also important to walk, to exercise. That's very important for health in general. So thank you very much. Thank you for watching, and we hope to see you again soon. Take care.